Okay, hi, it's Dr. Buford. I'm here with Dr. Moore. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right off the bat, we're getting a good look inside the joint. You can see kind of a gray cannula coming in the front. The camera is coming in from the back. This structure over here on the left is your biceps tendon. That's the long head of the biceps. And we can see that it's torn. So we're going to pass a stitch through it just to secure it, anticipating doing a biceps tenodesis. There's the tear in the rotator cuff tendon right there. And then here we can see it's actually what we call a type 3 slap lesion, because this is really a bucket handle type of tear in the superior labrum. See that there? So you can see how the labrum used to be like that, and then when it tears you get this kind of bucket handle appearance. And that's called a type 3 slap lesion in the original classification scheme. And so the treatment for that at this point is going to be to debride out this flap, just like that. You can see how, hold the camera there, Dr. Moore. I got it right here. And so now we've got the flap debrided. We'll go ahead and pull back through the posterior aspect of the labrum and debride this posterior aspect of the flap here. There's a pretty good shot of that. And okay, so we've just about debrided the entire posterior labrum, the posterior extent of that bucket handle tear. We can see you've got some arthritic changes, some wear and tear changes in the cartilage on the glenoid, centrally right there. Not bad. But more importantly, that torn portion of labrum has been removed, so that won't bother you anymore. Hold the shaver, please. And so now we're going to rotate up. We're going to take a spinal needle and pass it through the biceps tendon. There you can see the needle coming right through the biceps. We're going to go ahead and pull out. We'll take a black wire called a super shuttle, and we'll pass that through. We'll take a grasper to me. Hold the camera there, Dr. Moore. And then we'll go ahead and retrieve this black wire. We're going to load this wire with a suture. First we'll retrieve it. We'll hold the camera. I got it right. We'll pull back on it. And so that gives us the first step in securing the biceps. We're going to do the same thing one more time with our spinal needle. And this time we're going to go ahead and come through the biceps again. No, I don't, guys. And there's a good spot right there. We'll go ahead and feed that through with the shuttle relay. And we'll take a grasper. And this time we're going to feed a bunch of the relay through, because we're going to retrieve it on the other side of the biceps tendon, so we need a little more length here. So we'll reach in here. We'll grab it. We'll hold it still as we back the needle out, but then we're going to let go, and you'll see how we reach behind to retrieve the relay this time. And so now this time when we load that relay with the suture, it's going to create a loop around the biceps, which will allow us to secure it with a nice strong stitch. So here we are pulling back through. If you keep watching there, it looks like a mess now, but if you keep watching as we pull tight, see how that tightens up around it. Now we'll take a pair of arthroscopic scissors, and we'll go ahead and release the biceps at its insertion into the labrum here. So we're going to release the biceps right here. Okay, and so now that's the beginning. That's actually called the biceps tenotomy. Once we secure it again, that's what makes it a biceps tenodesis. So the next step is going to be just to smooth out any of the areas here that might be a little bit rough. We don't want to leave anything loose that could cause any symptoms in the joint. So pretty happy with that. And now we're going to look up at this rotator cuff, which is torn right here. So we'll start our rotator cuff repair from the articular side here just by using the shaver to clean up some of the edges and to clean up the insertion site for the rotator cuff, which is what I'm working on right now. The next thing we show you will be up above the cuff looking down, and you'll be able to get a really clear understanding of what the tear looks like before we fix it. Okay, so we're up above the rotator cuff now. The tear is right here. That's actually cartilage that we normally shouldn't see. This is the edge of the torn tendon right here. The back of your shoulder's on the left, front of your shoulder's on the right. Your clavicle, the end of your clavicle's right there, so that's the AC joint. You've got this spur hanging down from the acromion, so that's what we call the medial acromial facet at the AC joint, and that needs to go because that can pinch on the rotator cuff. And that's all it takes to make that go away. We know from your x-ray that your AC joint is also pretty arthritic. So we're going to start from the AC joint and work our way forward. You've got a very large spur underneath the acromion. I should say just the way your acromion's shaped. Look what happens here. This is where we're at, but then as we get to the front, this bone comes all the way down. See how this downward slope right there? So we need to start at the tip of this and level this off so that the rotator cuff's not getting pinched anymore. And so there you can see how we do that. And so now remember that downward slope that we were just looking at's gone. I'm going to rotate the camera around just to make sure that we're all the way to the front and all the way lateral here. And we're going to clear, there's a little clot in the shaver, or in the burr rather, but we're going to clear that in just a minute. But that already looks better, so we'll show you some more in just a minute. Let's put the shaver on. Okay, so there's the anterior acromion. That's nice and flat now. You can see it from a couple different angles. Okay, so I'm happy with that. The tear is right down below here. We're going to start working on that in a minute here. First, we're going to place a different cannula in the front of the shoulder. So we have to get that organized. We'll go off on the video and show you that in just a minute. Okay, so here's the tear in the tendon. There's our spinal needle. That shows us kind of the central point of the tear, which is right about here. The torn edge of the tendon, this is the posterior edge. This is kind of medial, right in the middle. And this is the anterior part of the shoulder. Your biceps tendon is actually right there. That's the cut edge of your biceps that we're going to be working with in a minute. So we're going to place a suture anchor down right about here and use the sutures to repair this tendon back down to the bone. Now, we've cleaned off, I think, just about enough of the insertion to get to work here. Just going to make sure. We'll pull this out just a little bit, just like that. Okay. I'm just going to flush it out a little bit so we can see. So I think that's pretty good now. There's a little split here, isn't there? So that's one of the things I was looking at. I'm going to take a grasper, please. I may need to put a separate suture across that posterior split. So we're going to take a feel of this here. We'd like to bring this up like that, and so that means putting a stitch across there. So we'll take a straight crescent suture hook, and we'll show you how we do that first. Okay, so we're going to hold the camera right about here. Here's our suturing instrument. It's loaded with a shuttle relay just like we used for the biceps tendon. And we're going to pass the first limb right there. We'll go ahead and feed that relay through. We'll show you what we do in just a minute here. Okay, so we're getting ready to place the second half of that stitch. Pull back a little bit, show me. You can see the first stitch is looped around there. Now we're going to get into this portion of the tear. We're going to pull this up. And see how we're going down and all the way through there. We'll feed that through and show you some more in just a minute. Pause. Yeah. So now we have a stitch tied or passed around the tear there. And you can see the loop. And when we tie that, that's going to help secure that part of the tear. So we're going to go ahead and tie this now. You'll see an instrument that's basically just a hollow tube coming in on the left side of the screen. It's called a knot pusher. There it is there. And so we use that to push these knots down and make sure that they're secure. There's a lot of different knots. Most of them originally started with taking knots from boating and yachting and converting them into surgical knots. And so there's a knot down that we call an SMC knot, which is what we call a locking sliding knot. So that's going to hold these two limbs of the rotator cuff together. We're probably going to have to do the same type of side-to-side stitch one more time, so we'll have one more free suture ready to go. Something a different color here to make it easy to see. So right now we're just throwing some half hitches to secure this knot. It's a lot like tying your tennis shoes through a straw here. We're just pushing it down through that blue tube. And now we're ready to go ahead and cut the suture tails. Okay, and so that's the first stitch. And so what we're trying to do, see how that's helped close down that gap there? I still think I've got to do one more to give me a good repair on that posterior tear. Okay, so now we're going to do one more side-to-side stitch here. First going through this posterior limb just like we did the first time. We'll feed that through. Got it. And we're going to load that with a suture just like before. This is a slightly different color. And then next we'll use our turn to the left suture hook to come from the other side. So here we're going to take this back. And we'll use our turn to the left coming from the anterior or the right side of the screen. To make sure we get that. So there's the hook. We're going to try and get a stitch. Do me a favor, when you load these relays, just pull them all the way back so they're not sticking out through the tip. Um, there you can see how we get all the way underneath there. We'll feed that. That's a good bite. And we'll retrieve that here. Pause, please. Okay, so we've got the second suture passed and tied in the back. That closes down that posterior split. And now we're left with the tear right here. We still have to anchor that part down to the bone. So it's a little bright. Let me see if I can fix that. Maybe that helps a little bit. So we're going to work right here next. Spinal again. Yeah, it is indeed. So here's our spinal needle. There's the cut edge of your biceps tendon, so we know we're all the way to the front. We're going to place an anchor down right about here. Scalpel. You can pull it. And now we're going to place a guide in that allows us to place our suture anchor. So there's the guide. We're going to place this right at the edge here, or really a couple millimeters back from the edge of the articular margin. So there's the articular margin. See where it turns kind of bright white there? That's articular cartilage. The joint would be going down there. That's going down towards the joint. So we're going to go ahead and back off just a little bit and place an anchor down right about here. Here you go, anchor. So this anchor is made out of suture. It's called a Why Not RC Pro. So we take that down to bone, and then we unload it. And then we pull back, and you can see the anchor's got 3 sutures in it. There they are right there. So we'll pull back, seat the anchor. It's very strong. And now we're going to reach in with our crochet hook and start tying these. We're going to start with a straight crescent, then we're going to use a turn to the right suture hook. So the the crochet hook rather, allows us to reach in here and take these sutures one at a time in whatever order we want. I'm going to take the solid, or the blue and white striped one rather, which as you can see now, that's what I've got inside the cannula. So now on this side of the screen, we're going to take our suture hook again, and now this time we're going to be passing stitches that anchor the tendon to the bone instead of just repairing the tendon to itself. So here's the hook. I want to get a stitch in basically something like that. I think you can just see me. That looks like a good shot right there. We'll feed the relay, and then we'll go ahead and load that and show you what it looks like. Okay, so there you can see that stitch. We're not going to tie that yet because it would make it really hard to do the rest of them. We're going to hold the camera there. We're going to hold the camera there. We're going to take those sutures outside the cannula and then proceed here. Okay, so now those sutures are out of the way. We're going to go ahead and reach in from the right side of the screen and take out the next suture in line. So looks like that's going to be this one here, this solid blue one. And then we're going to take a grasper in the front to Dr. Moore. And here's my next suture hook in line. Okay, hold the camera here. And what we're trying to do is repair this down to the bone just like that. So okay, pause. Okay, we can let that. I think the next one's going to have to be a turn to the left. You stuck on it. Where are the bicep sutures? Here's one. Thanks, Vern. Alright, I think we'll be okay with that. Okay, so grasper to me, turn to the left. Okay, hold the scope here. Okay. Ah. Grasper. Recording. Okay, so now we're going to go ahead and get all the sutures out the front and tie them one at a time from back to front. So you can see us just getting the different colored suture pairs together. And there's one more to get here. Hold right there. That's the last set right there. Okay, and so now we're going to pull these out one at a time from the back. So there's the blue and white one first. Okay, we'll get the other one also. Okay, so that's our first loop. We're going to tie that. This is the most posterior one. Okay, so there you can see your biceps. You've got our sutures around it, and we're going to use a different kind of anchor called a pop lock anchor just to secure it right there. I'm just trying to see if I can use the same cannula or not. That actually probably is a good shot. Because there's the tendon. This will allow us to secure it right in situ. So in order to do that, I'm going to take these two sutures inside the cannula. We're going to take a punch and we'll show you how we finish this in just a minute. Okay, we're all done now. Let me just show you what we've completed here. The tear was right there. We've got two side-to-side sutures and one triple-loaded anchor. And then we fixed the biceps tendon using what we call a pop lock anchor. And so this gives us a biceps tenodesis right here. And so we're all done. That's the biceps going down into the bone there. And the rotator cuff is moving together as a unit. So hopefully that'll do the trick for you now. Do we have a 2mm punch? Something like that? Okay, we're going to take a little punch and make some little vent holes in the tuberosity to release some of the stem cells and bone marrow elements, okay? But this will be the end of the video. Good luck to you now. Bye-bye.